everyone. The first time that I read this news that I'm going to talk about, that must be a joke, because someone was just asking, what do you think about this? And I responded, I said, this is ridiculous. Who is going to, what was they going to be? But mainstream media are carrying it. That means there's some that it's reality, it's true, it's kind of. But anyway, let me go right into it. And I'm taking this from Punch. It says Jagba, Tinubu approves policy to retain medical experts within Nigeria. Are we back to slavery era? Is this some dictatorship? Oh, okay. If you think that, I know some people will be like, yes, that's the way. After all, doctors are leaving. Make conducive environment for them to stay. If you don't put conducive environment, you cannot hold people down. If you want people to stay in Nigeria, then give them conducive environment for them to stay in Nigeria. They start with, medical field now, doctors and whatever, and you're happy. Tomorrow it will be you, they will say that you cannot travel out of Nigeria. They will also put a law and say that because you are traveling out of Nigeria, whether for holiday, whether for business, whether for anything, that you're the one causing dollar to increase or dollar to do one thing or the other. We see very dictatorial tendencies, and instead of us to nip it at the bud, you find that some people, they just sit down and they are all into it, because we always view things with a very myopic lens, instead of thinking about what's the repercussion of action, what does this portend for everything. Are they not restricting people's rights for movement and all of that, right of association and stuff like that. But anyway, let me not get over myself, right? Let me read the article. Let's go ahead. Bola Tinubu has approved the national policy on health workforce migration to address the challenges facing Nigeria's health human resources. The Coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, disclosed this on his X handle on Monday. Pate said the policy is more than just a response to the ongoing exodus of healthcare professionals, but a comprehensive strategy to manage, harness, and reverse health worker migration. Before I even go on, there are some things that are so annoying. I can tell you this for a fact. I do travel, so compared to an average Nigerian, like, I travel a lot, but compared to some people, not a lot. I just came back from a trip abroad, and I came back this morning. I left a few days ago, and I can tell you something. Nigerians who are living abroad, most of them don't want to be abroad. Even those that have jackpot, most of them don't want to be abroad. They want to come back home. You see the passion with which they talk about Nigeria. You see that need to make Nigeria work so that they will have a place to come back. For some of them, getting to understand the reality that that home that they think they want to come by is not what it is. You hear of a lot of Nigerians who have worked over there, who have retired, who have come back to Nigeria, and within few months having to run back. I mean, some talking about the fact that people they have done sent forth parties for, closed down everything, maybe sold their houses, done everything, feel that after 40-something years abroad, they're going back to Nigeria to go and rest. They come back to Nigeria, they can't stay. So people that you see are doing jackpot, they are living. They are not living because they want to be outside. They are not living because it's fun out there. They're living because we have a significant and major problem. Lives are not safe. Doctors, if Nigerian Medical Association should come out and tell you the number of doctors that are in captivity, that have been abducted, kidnapped, killed, yet the government hasn't done anything about it. And then you see that somebody that wants to leave the country, you are telling him that you are bringing policy that they cannot leave the country, they cannot do this, they cannot do that. For me, I live in Nigeria. My healthcare, whatever, I go to hospitals in Nigeria, and anytime I actually see a doctor, most time, let me not say all the time, anytime I see them, I always appreciate. When I say it, I say thank you for staying. It's not easy. You see some that will tell you they can't even leave abroad, they are not ready to go anywhere. I appreciate them. You understand? We know there is a huge medical crisis because we are having more and more doctors are leaving, nurses are leaving, medical practitioners are leaving, no doubt about it. But you cannot go and put a law or something, policy or whatever, and then now force them to stay here when you have not given them that environment for them to thrive. You show your head no correct. And you're not bow no. When I think I saw they do something, honestly, as I think it's at the verse, yes, I'm affected. Yes, the more doctors leave, the more the people that I will go and meet when I go to hospitals are not there. Yes, but the solution is not to come and bring some, looking for some draconian means to force them to stay here. The solution is to make Nigeria better. If you make Nigeria better, we will have more doctors coming back. Even those ones that have gone there and have trained themselves, have gotten the knowledge and everything, they will come back. They are ready to come and establish in Nigeria, but Nigeria does not have that good enabling environment for them. There is one, I think a woman, was it 2023? Last day they took her. One of the few, is it? I can't remember. In short, because I would have looked for that woman's this the name to put it up. She's I think she's one of these brain surgeons in her own hospital in Calabar, I think it was, if I remember that report very well. They went in there, they took her from her office up till now. Up till now, her people have not seen her. This is a professor. This is a big guy that we've trained. You've not been able to take care of them. Those are nothing. Oh, the other time, NMA, they came out they did protests on their members that had been abducted. There's one in Kaduna that they are asking to bring almost, is it $500 million? Where is a medical doctor? The medical doctor went for an assignment, official assignment. Before he came, they took his wife and his 4 children. The elder one has been killed because they couldn't pay ransom. Where was Tinubu when all of this were happening? Where is the Nigerian state? You keep quiet. You don't take care of your citizens. You don't take care of the people who are contributing to the nation. And for those of them who are going abroad to go and look for a better life for themselves and their families, you're coming down to put some nonsense policies that, oh, they cannot live. You are putting whatever. In short, let me go back to my report. Pate said this afternoon, Bola Tinubu, with all those their long title or whatever, me no get her for those na long title, approved the landmark policy set to transform healthcare human resource management in Nigeria. The national policy on health workforce migration addresses the critical challenges facing Nigeria's health human resources. As the AU champion for human resources for health and community health delivery partnership, Tinubu's commitment to a resilient and robust healthcare system is powerfully reflected in this forward-looking policy. The policy is more than just a response to the ongoing exodus of healthcare professionals. It's a comprehensive strategy to manage, harness, and reverse health worker migration. It envisions a thriving workforce that is well supported, adequately rewarded, and optimally utilized to meet the healthcare needs of all Nigerians. So of course, they will use English now. Many Nigerian healthcare workers leave the country for greener pastures, leaving their colleagues to contend with additional workload and extended hours. And what Nigeria should be doing at this moment, for me, and I've said this thing several times, why can't we begin massive training of nurses and healthcare workers? A lot of people that are supposed to be doing medicine are there doing microbiology, biochemistry, and some of them end up with botany, zoology, whatever courses that should be. Why can't we open more this thing? Let's start training these medical doctors. Fine, the world needs Nigerian medical doctors. They need Nigerian nurses. Let's start training them. How many infect doctors do we usually utilize in Nigeria? Turn some of those this thing around. People are doing BSc anatomy. People are doing BSc physiology. Of what use are those ones? Let's start having BSc instead of BSc anatomy, physiology, embryology, histology, and all of those things. Why don't we have them at master's level? Let all of these people, because most of the people who do them anyways are the ones who came for MBBS medicine. Let everyone be doing MBBS. You do all of these things. Then when you want to specialize at the master's level, and then you can teach, you can do all of that. So let's have more people. There are a lot of people who would have done medicine. They ended up in pharmacy because that was what the university gave them. So why don't we rejig in such a way that Nigeria is producing doctors for the world? Yes, there will be a source of income also for the country. They're going to send money back home anyways. Let's embark on What are the training facilities we have? Let's say the next 20, 30 years, we're going to be producing 1 million doctors for the world. Let them be hiring, let them go. They will send the money, use it, instead of sitting down and trying to look for how do you hold people back. What is their business if there's more workload for the people that they left behind? Are they the ones that told you not to give them conducive environment for them to live? The ones that they've kidnapped their families, did the government pay ransom? He was working for the government. He was on official assignment, and they kidnapped his family. They kidnapped his wife and children. His first son has been killed. What has the government done about it? And then you just sit down and tell people that you're going to put a policy, their workload, and whatever and however. Some things they really annoy me when we just work on this. Okay. The push factors, according to them, are inadequate equipment, worsening insecurity, poor working conditions, and poor salary structure. The minister noted that central to this vision is the Nigerian Human Health Resource Program, which sets a framework for regular reviews of working conditions, ensuring that health workers, especially in rural and underserved areas, receive the recognition and rewards they deserve. By fostering an environment conducive to professional growth and stability, the policy aims to retain top talent within Nigeria. Is this policy, are they going to create a new word for doctors? They don't know that whatever happens, that it's a reflection of the society. The society is not taking care of, everybody is affected. Anyway, in an increasingly digital world, integrating advanced health technologies is essential. The policies focus on digital health infrastructure, including electronic medical records, telehealth, and a comprehensive health workforce registry, marks a significant step towards a more efficient, data-driven health system. This is a country that every market day there's a national grid failure. Oh God, when these people are talking, I don't even know whether they talk with reality of Nigeria in ground or some fanciful thing. Anyway, these innovations will streamline healthcare delivery and enhance the equitable distribution of health workers, ensuring access to quality care for all Nigerians. Capacity building is at the heart of this policy. It recognizes the importance of continuous professional development with strategic partnership and opportunities for international training to equip our healthcare professionals with cutting-edge skills. This investment in human capital underscores our commitment to retaining and empowering our healthcare workforce, he stated. He added that the policy addresses the return and reintegration of Nigerian health professionals from diaspora. He said by establishing a streamlined registration processes and providing attractive incentives, the policy not only encourages the return of talented professionals, but actively reintegrates them into the healthcare system. The approach leverages the expertise of our diaspora to bridge gaps within the health sector. Perfect, that particular one. Also, the policy champions reciprocal agreements with other nations to ensure that the exchange of health workers benefits Nigeria. These bilateral and multilateral agreements are designed to protect national interests while respecting the rights and aspirations of our healthcare professionals. We call on recipient countries to implement a one-to-one match, training one worker to replace every publicly trained Nigerian worker they receive. Recognizing the importance of work-life balance, the policy includes provisions for routine health checks, mental well-being support, and reasonable working hours, especially for younger doctors. These measures aim to create a supportive work environment, reducing burnout and enhancing job satisfaction. The governance of this policy will be overseen by the National Human Resources for Health Program within the Federal Ministry of Health, Nigeria, in collaboration with state governments. This ensures responsible implementation and alignment with broader sector-wide health objectives. With this decisive action, the national policy on health workforce migration is set to secure the future of Nigeria's healthcare system. Under Tinubu'S leadership, this policy will further catalyze the transformation of our health sector, ensuring access to quality healthcare for all Nigerians. As we embark on this journey All stakeholders are invited to contribute to building a healthcare system that reflects our nation's potential and promise. Party noted. And this is also to add the fact that they always say all stakeholders whatever, but they never listen. People talk, people give advice. People say, why do you always criticize government? Why are you not giving advice? Even with the advice, they never listen. Before you know what's happening, they put spanners in the will of those who want to live. As far as I'm concerned, if Nigerian doctors are in demand, Nigerian health workers are in demand, Nigerian nurses and all of that, why don't we make this a project and begin to train more of this to go there? We have 220 million Nigerians. A lot of people want to read these medical courses and they're usually being denied. Let's put our attention towards doing that. I don't mind having every hospital in the world have a Nigerian doctor in there. That would be a win for Nigeria. That would be a source of, forex for Nigeria. Diaspora remittance, that's huge. That would be huge. So let's work on that and stop just limiting ourselves. Thank you so much for watching this very long video. If you got to this place, Omo, you are my most MVP. Thank you and God bless.